Joining us now is Dr. Navesh Sharma, Medical Director of Radiation Oncology at WellSpan Health, also John's doctor. Tell us more about this Pluvicto.
So Pluvicto is an exciting enhancement to what we can offer our prostate cancer patients. It's a form of therapy called radioimmunotherapy, which targets a specific kind of marker that prostate cancer cells have. By targeting a specific marker, what it's doing is actually minimizing side effects because it's really going after prostate cancer cells that have PSMA or prostate-specific membrane antigen. And it's for patients that have basically not been able to get, that have had other types of therapy that they've progressed on. So something called androgen receptor pathway inhibitors or chemotherapy that they failed. So it allows them to actually get a new option to cure, not cure, but control the disease.
Well, for sure, because, it was so beneficial to John. It really changed his life. What makes it so beneficial to prostate cancer patients?
I think the biggest benefit is that, once again, these are patients that in the past would have had no further options, but you're being able to target cells in the body that just have this one particular marker that's prostate-specific membrane antigen. So it's beneficial because the radioisotope goes and kills those cells that have this marker on them, but does not affect the other cells in the body. So the side effects are a lot less, or a lot fewer than we'd see with some of the other therapies that we offer them. And it doesn't matter where the disease is in the body, it can go after all of it as long as it has PSMA on it.
That's remarkable. Yeah. That's incredible. Any other new treatments that WellSpan can offer?
So we have the entire plethora. So as Director of Radiation Oncology, I have the option of, basically looking at everything that we have. And I think we have a very comprehensive list of things we can offer our patients. The biggest thing that we have right now is a partnership where we can actually offer proton therapy, a new form of radiation therapy that has certain benefits.
Tell me more about that. What really is proton therapy?
So proton therapy is actually another form of radiation therapy, but it's thought to be something that's more targeted. It was originally developed for children and people with brain tumors, but it allows us to, in certain patients, be able to treat just the tumor and minimize the side effects of the tissue around it. It is still a radiation therapy form, but it allows us to be a little bit more specific in certain patients that are good candidates for it.
And does it treat multiple different kinds of cancers?
It can be used to treat multiple different kinds of cancers in the right situation. So those cancers that may not be good candidates for standard photon-based radiation therapy, it's a different form of radiation therapy option that we do have now.
As a provider, how do you figure out what is the best for each patient?
So we really try to do something, we try to treat every patient with a multidisciplinary approach. So we try to make sure that they have opinions from surgical oncology, medical oncology, and radiation oncology as part of the care. And even within radiation oncology, we always peer review our patients, which means we have our physicians that have treated multiple sites at different top-notch institutions. What we try to do is find out what's the best possible plan. Can we do this with photon radiation? And if not, is it possible to then consider for these patients for proton therapy?
It must be so fascinating, so rewarding for you when you're like, bingo, that's the one.
Oh,
right?
It definitely is. And when you have somebody like John have such a good outcome, it makes everything we do far more rewarding.
Yeah, what a guy. You changed his life for sure. Thank you so much. Great talking with you today.
Thank you for having me.
Thanks so much to Dr. Sharma. For more information, or if you would like to make an appointment with the WellSpan Health Cancer Institute, visit wellspan.org/cancer.